This is a video showing how you use your X-ray machine, the exposure machine. First, you have to make sure your X-ray machine is charging prior to the exposure. This is because you can't use the exposure machine while it's charging. So if you want to use the machine, you have to remove the plug from the socket. Next, we have a switch behind the machine where it should be on. That's the one that's up. Then there is also a switch towards the left hand side. So towards the right, we have the indicator for charging. We also have a screen bar. Then we also have the KVP control and the MES control. The KVP control has an indicator where the figures are written, and also for the MES. So if you press the upper arrow, that's to increase, the lower arrow, that's to reduce. This is dependent on the body mass of the patient. Now this is where the marker for the X-ray cassette is. This is where the cassettes are stored. We have two different sizes of cassettes depending on the exposure you want to do. So this is how you control your machine. There is a switch at the handle where my hands are on. So when you want to move, you have to press it down before the movement can happen. Both the rotation and the movement up and down, basically. So depending on where you are exposing, also there is a light which shows the area that is going to be exposed. This area is going to be useful so that you know the region you are exposing to. These knobs control the ray of light, the ray of light. So if you're increasing the one on the right, you're increasing the width of the exposure, the exposed area. Then if you're increasing the one on the left, you're increasing the height of the exposed area. So basically this is going to be needed when exposing a patient. So before you do a chest X-ray, you have to place your cassette on the stand. The darker side should be facing the patient, and it should be properly placed before you expose the patient. This is all dependent on the type of X-ray scan you want to do. So this is when the patient is standing. That's the patient is either in the AP position or the PA position or lateral erect. Then when the patient is lying down, either the supine position or the prone position or lateral. So this is basically for an illustration for the chest X-ray. So depending on whether the patient is in the AP position or PA position. So this is the placement for the PA or AP positioning for chest X-ray. Then this handle is basically to control your light. That black place is for the light. So once it is pressed, the light comes on. This is going to be useful when you go into the light region when exposure is happening. So when you press it, the light comes on, so you can see the light from the cubicle. So this button is for the exposure. So once it is pressed, you press it for 5 seconds. So one important thing while doing your exposure is to put on your lead jacket. It is very, very important for safety reasons.